Okay, let's dive in. If you're a federal worker and you're filing a workers' comp claim under FECA, well, the goal seems simple enough, right? Get coverage for an injury that happened on duty.
Right, straightforward on the surface.
But here's where it gets really tricky, a massive hurdle, really. What happens if your injury or the diagnosis mentions degenerative conditions? Things like arthritis or degenerative disc disease, maybe just wear and tear.
Yeah, that's exactly where the system tends to hit the brakes hard. The Department of Labor's OWCP, the Office of Workers' Compensation Programs, they get immediately skeptical.
Skeptical why? Just because those conditions are common.
Precisely. Degenerative changes are incredibly common. Lots of people have them without any symptoms, and they naturally get worse with age. So the moment those words pop up in your medical file, OWCP starts thinking, maybe this is just age-related, not work-related.
Okay, and our sources are pretty clear. This skepticism often leads to, well, almost a knee-jerk reaction from OWCP.
It does.
Yeah.
They order a second opinion exam almost automatically whenever degeneration is part of the picture.
So that's the core issue we're unpacking today. OWCP is trying to figure out, okay, is this injury really because of work, or is it just a pre-existing condition doing its thing?
Exactly. And our mission here is to really explore why that second opinion exam becomes such a big challenge, and probably more importantly for you listening, how you can prepare proactively.
So your legitimate claim doesn't get tossed aside as, just degeneration.
That's the goal, avoiding that simple, dismissive denial.
All right, so let's tackle that core conflict head on. If I already have some arthritis, say, why does proving my work injury suddenly become so much harder? The burden of proof feels heavier.
It is heavier, legally speaking. OWCP makes it very clear. They won't just assume your work caused the degenerative condition or even that it made it worse.
Okay.
The burden shifts entirely onto you, the employee, to prove that the work incident materially aggravated that underlying condition.
Materially aggravated. That sounds like legal speak. What does it actually mean for me, practically?
It means you have to show the work incident pushed your condition beyond how it would have normally progressed with age. It's not enough that work hurt.
So give me an example, like my knee.
Okay, yeah. Let's say you had mild arthritis in your knee, no real symptoms, you barely noticed it. Then you slip on a wet floor at work, fall hard, and suddenly you have severe knee pain, and maybe an MRI shows a new meniscus tear alongside the old arthritis.
Right.
You can't just say the fall caused your disability. You need to prove the fall either significantly worsened the underlying arthritis itself or caused a new acute problem, like that tear, which materially reduced your knee function compared to right before the fall.
Wow, okay. That's a fine line to draw medically.
Right.
And I can see how if my own doctor says, yep, the fall caused the pain, but the MRI report mentions degenerative changes.
That's when the second opinion trap springs shut.
Automatically.
Almost always. The claims examiner sees degeneration, sees your doctor linking the symptoms to work, and thinks, we need another look at causation. So they order the second opinion.
And the likely outcome of that exam isn't great based on what we've seen.
Well, it's often predictable. Many of those second opinion reports come back saying the condition isn't work-related precisely because it's degenerative.
Even with the new injury, like the tear.
Sometimes, yeah. The OWCP hired doctor might provide a rationale, maybe a thin one, but a rationale that allows the agency to say, nope, this is mostly just aging, not the work incident. It gives them cover to deny or limit the claim.
Okay, so if that second opinion is often kind of stacked against you, or at least looking for that out, the real key seems to be preparing before you even get to that point, like choosing your first doctor carefully.
That's exactly what the sources point to. It sounds basic, but choosing the right treating physician from day one can genuinely make or break your entire claim. It's about setting the foundation correctly.
But hold on. What if I have a family doctor, a GP, who's known me for years? They know my history. They know I wasn't complaining about my knee before the fall. Wouldn't their opinion count the most?
That makes intuitive sense, but it's not how the system weighs medical opinions. You absolutely have the right to choose your doctor, but OWCP and the Employees' Compensation Appeals Board later, if it goes that far, give significantly more weight to specialists.
The specialists
like a board-certified orthopedic surgeon for a knee or back issue, or a neurosurgeon for spinal problems, someone whose expertise directly matches the complex injury involving degeneration.
So the more specialized the doctor, the more credible their opinion on something complicated like arthritis plus a tear.
Exactly. Their assessment of complex degeneration just carries more what they call probative value than a note from a general practitioner. But just picking a specialist isn't the whole story.
Okay.
That specialist needs to write the right kind of initial report. They have to do some specific heavy lifting in that first narrative they send to OWCP.
And what does that right kind of report need to include? What's the heavy lifting?
Two crucial things right off the bat. First, they need to clearly differentiate the acute injury, that new meniscus tear, a fresh disc herniation from the chronic pre-existing stuff like the background arthritis.
Okay, separate the new from the old.
Right. And they need to explicitly address the pre-existing condition. Was it asymptomatic before the incident? Was it mild? They need to document the baseline.
Got it. Documenting the starting point. What's the second thing?
This is the absolute key. Providing the medical rationale, explaining how the work incident specifically acutely aggravated or significantly accelerated and worsened that underlying degenerative condition. It can't just be implied.
It needs the magic words.
Pretty much. And specifics. The report should say something like, the trauma from the fall on March 5th acutely aggravated the patient's pre-existing but previously stable lumbar stenosis. This resulted in new L5 nerve root impingement confirmed by the recent EMG findings, which represents a material worsening beyond the expected natural progression of his degenerative disease.
Wow, that level of detail.
Yeah.
Sounds like it's directly aimed at countering that it's just wear and tear argument before it even gets made.
That's precisely the point. It's the best preventative medicine for your claim. A really strong, well-reasoned initial report from an orthosurgeon who gets OWCP. Sometimes that can actually stop OWCP from even ordering a second opinion.
Really, it can prevent it altogether.
Sometimes, yeah. If the causation is laid out that clearly and supported by evidence, there's less ambiguity for the claims examiner to question. And even if they do order the second opinion, that solid initial report becomes your primary defense against a quick dismissive exam.
Okay, let's shift gears then and talk about the reality of those second opinions.
Yeah.
Because the picture painted by our sources isn't exactly encouraging for the person walking into that exam room.
No, it's often not. The most common thing you hear in that workers' report is that these exams feel incredibly rushed. Superficial, even.
How rushed?
People frequently say the doctor spent maybe 15 minutes with them, sometimes less, for a complex back problem or a shoulder injury with years of history. That's barely enough time to get the basics.
15 minutes? Seriously?
Yeah.
How can a doctor possibly understand the nuances of, say, degenerative disc disease plus an acute herniation after a work injury in just 15 minutes, let alone write a comprehensive, rationalized medical opinion?
Well, that's the million-dollar question, isn't it? Often they probably can't do it adequately. And that's where this perception or maybe reality of bias creeps in.
Bias because they're paid by OWCP.
That's the concern, yes. These doctors are hired by OWCP. They see a lot of federal workers' comp cases. So there's a feeling among injured workers that maybe there's pressure or just a tendency to lean towards interpretations that limit the claim, especially when degeneration is involved. It's easier to blame age in a quick exam.
And that lack of thoroughness leads to?
It often leads to boilerplate language in the report. Conclusions that sound generic, minimizing the work connection, maybe not even mentioning the specific findings from your own specialist, and just blaming the pre-existing condition.
Okay, this sounds discouraging. But let's talk about the weight of these opinions. If my specialist writes a detailed 10-page report with objective findings and clear reasoning, and the OWCP doctor provides a 2-page report based on a 15-minute exam that seems to gloss over things,
Yeah.
how does OWCP weigh those? Am I just stuck with a second opinion?
This is critical for listeners to understand. No, you are absolutely not just stuck. The regulations themselves and decisions from the appeals board say that when medical opinions conflict, a well-reasoned, well-supported report from a specialist, one that includes objective findings and a clear medical rationale, carries more probative value, more legal weight than a vague, conclusory, or poorly rationalized report.
So a flimsy second opinion can be outweighed.
Definitely. If the OWCP doctor's report is clearly rushed, doesn't address the specific evidence your specialist provided, or fails to offer a convincing rationale for disagreeing, your specialist's thorough report should carry the day. You're not powerless against a quick assessment.
That's a really vital piece of information. Okay, so knowing that, let's get tactical. If you get that letter saying you have to go for an OWCP-ordered second opinion exam, what concrete steps should you take beforehand to protect yourself?
Preparation is everything. First, read that OWCP referral letter very carefully. Understand the exact questions the claims examiner has asked the doctor to answer.
Like what?
Like, has the work injury resolved? Or, is the claimant disabled from their usual job due to the accepted conditions? Or, is the proposed surgery medically necessary because of the work injury? Your preparation and what you emphasize in the exam should focus squarely on those specific questions.
And should I just assume OWCP sent the doctor my complete medical file? All my specialist reports, my MRI results?
Absolutely not. Never assume that. It's a very good idea, strongly recommended actually, to bring your own neatly organized copies of the most important documents.
Which ones?
Definitely the key reports from your treating specialist, especially the initial one with the strong rationale, any recent relevant imaging reports, MRIs, CTs, maybe even a summary of your functional limitations.
And why bring my own copies?
You politely offer them to the doctor or their staff. You can say something like, I brought copies of my recent specialist report and MRI just to make sure you had everything. This way, they can't later claim in their report, well, I didn't have Dr. Smith's detailed findings to review. It covers you.
Wow. It's kind of stunning that you might have to basically do the agency's work of ensuring the doctor has the key records.
It happens more often than you'd think, so proactive preparation is key. Then, during the exam itself, your conduct is important.
How so?
Arrive on time. Be polite, professional. Don't be hostile, even if you feel defensive. Wear appropriate clothing, shorts for a knee exam, a tank top, or a loose shirt for a shoulder so they can actually examine the injured area easily.
And consistency matters, right? No exaggerating, but also no downplaying.
Exactly. Credibility is huge. These doctors are often looking for inconsistencies between what you say, what's in the record, and how you present physically. Be honest about your pain levels, your limitations, what you can and can't do.
What about the physical tests they do? Sometimes they ask you to do things that really hurt.
Perform the tests to your tolerance. If a movement causes sharp pain, say so. Okay, that's causing sharp pain in my lower back right there. Don't push through severe pain just to seem tough, but also don't refuse a reasonable test outright unless there's a very clear safety reason. Show your genuine functional limits.
Can I bring someone with me, like a spouse or union rep? Can I record it?
Recording audio or video is generally a no-go. OWCP usually prohibits it. Bringing someone as an observer is sometimes possible, but it's entirely up to the doctor's discretion and their office policy.
And if they allow it.
That person must be a silent observer. Their only job is to watch and take notes. No interrupting, no answering questions for you, no interfering at all. You need to ask permission beforehand.
Okay. Now, you mentioned notes. What's the absolute most critical thing to do the minute you walk out of that exam room?
Document everything immediately. Like sit in your car, use the notes app on your phone, whatever works. Write down everything you can remember.
Like what specific?
How long did the doctor actually spend face-to-face with you? What specific physical tests did they perform? Crucially, what tests did they not perform, especially ones your own doctor uses? Did they ask about your job duties? Did they seem to dismiss any of your symptoms? Write down any specific quotes you remember. Note if they seem to be reviewing your file or just glanced at it.
Why is this immediate note-taking so vital?
Because that second opinion report might not show up for weeks or months. Your memory will fade. Those contemporaneous notes are your best tool for recalling accurately what happened, and they become incredibly important if the official report contains errors, omissions, or misrepresents what occurred during the exam.
So those notes are your ammunition if or when that unfavorable report arrives saying it's just old age. Let's talk strategy then. The bad report lands. What's the first step?
First, get a copy of the report. You usually get it from your claims examiner, or you can find it in the eCompy system online. Then, compare it side by side with those detailed notes you took right after the exam. Look for discrepancies, errors, things they left out.
Okay, found the problems. Now what?
You immediately take that report back to your treating specialist, your orthopedic surgeon, your neurosurgeon.
Their job isn't just to disagree, right? It needs to be more specific.
Much more specific. They need to write a formal rebuttal. This could be a letter or an addendum report. It needs to tackle the second opinion doctor's conclusions point by point.
How? With what evidence?
Using objective evidence. They need to say, Dr. Jones concluded X, however, this fails to account for the acute findings on the MRI of date, which clearly show Y. Or, Dr. Jones's opinion on causation ignores the documented fact that the patient was asymptomatic prior to the work incident, as noted in my initial evaluation. They cite specific findings, maybe even medical literature if relevant, to systematically undermine the rationale of the second opinion report.
So the goal of this detailed rebuttal from my specialist is essentially to create A fight, a conflict of medical opinions.
Precisely. You want to create a clear, well-supported conflict. If your treating specialist provides a thorough reason rebuttal that directly contradicts the OWCP doctor's conclusions on key issues like causation or disability, and both opinions are well rationalized by specialists,
Then OWCP has a problem.
then, according to OWCP's own procedures, you have what's called equipoise, or a conflict in the medical evidence, a tie, essentially.
And when there's a tie between two specialists, what happens next? What's the procedure?
You then formally request OWCP to resolve the conflict by sending you for a referee examination. This is sometimes called an impartial medical examination.
A third doctor.
Yes, a third specialist, ideally board certified in the right field, who is supposed to be truly impartial. They review the entire case file, including both conflicting opinions and all the medical evidence, and provide a deciding opinion to break the tie. You have to formally request this referee exam citing the conflict.
This all sounds like it needs to happen fast. What if OWCP doesn't wait? What if they issue a notice saying they plan to cut off my benefits based on that bad second opinion?
You're right. Urgency is critical. OWCP must first issue a Notice of Proposed Termination or Notice of Proposed Reduction of Benefits. This notice gives you a specific time frame, usually 30 days, to respond before the decision becomes final.
That 30-day window is crucial then.
Absolutely crucial. That is your window to submit your specialist's detailed rebuttal and any other evidence arguing why the second opinion is flawed and shouldn't be relied upon. You need to show why it lacks probative value compared to your treating specialist's opinion. If you miss that 30-day deadline, the proposed action often takes effect automatically.
Wow, this whole process, the back and forth, the rebuttals, the referee, it really highlights why having medical experts who actually understand OWCP's rules and language from the very beginning is such a huge advantage.
It absolutely is. It's one thing to have a doctor who is great at surgery or treatment. It's another to have one who also understands the bureaucratic requirements of FECA.
Like the clinics that specialize in federal workers' comp.
Yeah. Exactly. Places like Restore Muscle and Joint, for example. They often have specialists, like Dr. Chris Main, you mentioned, an orthopedic surgeon with decades of workers' comp experience. They're not just focused on the medical treatment, they're focused on navigating the OWCP system correctly.
So they're essentially treating the claim paperwork as carefully as they're treating the injury itself.
That's a good way to put it. They know the forms, the CA1, the CA7, the narrative requirements. Critically, they know to proactively address that pre-existing degeneration issue in the initial report.
Oh.
By documenting it clearly, stating whether it was symptomatic or not before the injury, and then providing that strong evidence-based causal statement linking the work incident to the aggravation or worsening, they build that rock-solid foundation right from the start, anticipating the challenges.
And that specialized knowledge helps later too, right? Like if surgery is needed.
Definitely. They know how to frame the medical necessity for surgery in OWCP terms, linking it directly to the effects of the work injury, even when there's underlying degeneration. They provide the specific language and evidence OWCP needs to approve it. They can defend the claim effectively through every step.
So wrapping this up, what's the main takeaway for you, the listener, navigating this? It sounds incredibly complex, especially with degeneration.
It is complex, no doubt. But it's not hopeless. The key themes are preparedness and proactivity. Choosing the right initial specialist who understands OWCP is step one.
And step two is being ready to fight back if you get a bad second opinion.
Right. Meticulous documentation, your notes after the exam are vital, and getting that strong, detailed rebuttal from your own specialist, those are the keys to defending your right to benefits when degeneration is involved.
Okay, so preparedness and proactive rebuttal. Got it.
And maybe a final thought for you to really chew on. OWCP's own rules say that second opinion reports need to be thorough, rationalized, and based on the actual medical evidence. So think about how powerfully you can undermine an unfavorable report by documenting precisely how it failed to meet those standards. If you can show the exam was only 5 minutes, or the doctor never reviewed my recent MRI showing the acute tear, you're not just disagreeing, you're challenging the very credibility and probative value of that report based on OWCP's own expectations.
So your documentation, combined with your specialist's detailed rationale, becomes the weapon to counter a potentially rushed or biased assessment. You're not just a passive recipient of the second opinion.
Absolutely not. You have the ability and, frankly, the need to challenge it with objective facts and expert medical reasoning. That foundation you build early on with your own chosen specialist is often what makes the difference.